everyone. Myself, Dr. Jitendra Bhalerao, Assistant Professor, Department of Anaesthesiology, GMCS, Nagpur. I will be covering the topic of inhalational agent, neuromuscular blocking drug, and reversal agent. In relation to inhalational agent, I have covered some specific learning objectives. What are the ideal inhalational agent? I have described the classification, physiology and pharmacology regarding inhalational agent, neuromuscular blocking drug, reversal agents. I have also described minimal alveolar concentration and what are the side effect, complication and contraindication in relation to about drugs. Introduction in inhalational anesthetic agent. These are volatile agent administered in vapor form to the patient via pulmonary route. Inhaled anesthetics move down a constant gradient from vaporizer to body organ. They can be administered via face mask, laryngeal mask airway or endotracheal tube. Common inhalational anesthetic agents are nitrous oxide up to xenon from 1844 to 1997, these drugs are revolutionized by time period. Inhalational anesthetic, when we use the drug on the vaporizer, it goes to anesthetic circuit, then airways, then alveoli, then arterial blood, and to that body organs, vessel group, vessel pore group, fat and muscle. Inhalational anesthetic, these are volatile agents and it should have some physical property which are ideal, like non-flammable, non-explosive at room temperature, stable in light, liquid vaporizer, long shelf life, soda with lime, with plastic and metal, environmentally friendly, so that it should, there should be no ozone depletion, and cheap and easy to manufacture. Biological properties like pleasant to inhale and non-irritant, induce bronchodilator, low blood gas solubility, minimal effect on other system, no biotransformation, no toxic to operation theatre person. For the patient, induction recovery should be fast with no after effects. For the surgeon, it should provide adequate anesthesia, immobility and muscle relaxation. For anesthetic, it administered should be easy, controllable and versatile. Inhalational agent, one by one I will describe about volatile agent. First, sevoflurane. Sevoflurane was discovered by Ross Terrell and Bernard M. Regan. Sevoflurane is polyfluorinated methyl isopropyl ether. It is non-pungent, non-flammable. Its concentration rapidly increases in alveoli and which make it an excellent choice for smooth and rapid inhalation induction in both pediatric and adult. Properties of sevoflurane, it is volatile in nature, non-pungent. This all I have already explained. It has low blood gas solubility, boiling point around 58.6, vapor pressure 157 mm of mercury, and in neonate it has minimal concentration 3.2, infant 3.2, small children 2.2, adult equivalent to 2. Then I am covering minimal alveolar concentration. Minimal alveolar concentration that prevents the movement in 50% patient respond to standardized stimuli. MAC concept describe concentration versus response relationship. It is indirect measure of brain tissue concentration of anesthetic. MAC, it factors increasing minimal concentration like hyperthermia, young age, chronic alcohol abuse, acute amphetamine use, drugs, cocaine, ephedrine, it's live. Factor decrease in MAC, these are like hypothermia, acute alcohol intoxication, chronic amphetamia, drugs like opioid, ketamine, hyponatremia, etc. Route of administration, sevoflurane specific calibrated vaporizer attached to anesthetic machine. It is available in liquid form, comes with a filler and adapter. It is used for pour your fluor into vaporizer. It delivered via lung as volume percent of inspired gas. Mechanism of action. It is inhibitory postsynaptic channel activity by binding to GABA and glycine receptor. It inhibits excitatory synaptic channel activity by binding to nicotinic acetylcholine, serotonin and glutamate receptor. It has effects on other systems like cardiovascular system. Sevoflurane mildly depresses myocardial contractility, decreases systemic vascular resistance and mean artery pressure. Respiratory strength depresses respiration and reverses bronchospasm. On cerebral system, it causes a slightly increase in cerebral blood flow and intracranial pressure. It also impairs the autoregulation of cerebral blood flow. Neuromuscular system, sevoflurane produces adequate blood relaxation for intubation. In renal system, it decreases renal blood flow. Hepatic system, it decreases portal venous flow, but increases hepatic artery blood flow. Side effect of sevoflurane, it causes respiratory depression by augmenting narcotic pre-medication or other agents causing respiratory depression. It may prolong QT interval. It causes malignant hyperthermia. Sevoflurane we use as a maintenance for surgical anesthesia may be sustained with concentration 0.5 to 3% with sevoflurane without concomitant use of nitrous oxide. Then isoflurane, it is synthesized in 1968 by Terrell, introduced in patent in 1984. It is non-carcinogenic, it is halogenated methyl ether, non-flammable and pungent odor during induction. May produce coughing and breath holding. It is less soluble than halothane and enflurane, boiling point 48.5. It has no effect on metals. It's a vaporizer having purple color and vapor pressure near about 32.2. Mechanism of action, it decreases the NMDA receptor glutamate receptor activity and potentiates the glycine receptor activity.